Thank you, Mr. Chair. And I want to thank our witnesses today for taking time to be with us. Grand Chief, it's good to see you again. We had a good conversation a few months back, and I'm going to start with you. And you answered a bunch of this in your testimony already, but I want to give you a little bit of a more opportunity to talk about the medical transportation issue. It's an issue that has come up in many of our meetings in the last few months or a few weeks talking about this topic, and it's obviously very different for you where you come from compared to my riding in northern Saskatchewan, which I know you're familiar with because you did some work in Saskatchewan some years back. But you explained many of the challenges, and I'm just wondering if you would take a minute and just offer what you think some of the solutions would be to those travel challenges. I know you talked about initiating a review, but what specific things that would work for your communities that would be a significant improvement in that kind of travel component of the medical transportation system of the NIHB?
Mr. Chair, would it be all right if I answer that directly?
Please go ahead. Please go ahead.
Okay. Thank you for the question, MP Vidal. I must add that I think before we get into solutions, I must also share the two-tier system that we find ourselves with here in the NWT. If you are a government employee, chances are, by a factor of 4, that you are a non-Indigenous person. Your medical travel benefits allow for a hotel of your choosing, rental vehicle or taxis, flexibility in travel, and the Treasury rate of approximately $135 per day for meals and incidentals. Many of the employees of the governments of the NWT or Canada often use these medical travel excursions to extend and see family or go off to other destinations on personal travel. It is a true benefit. If you are a resident of the Northwest Territories who is not a government employee, chances are you are Indigenous, as we compose the majority of the population. Some of these individuals are status Indians under the Indian Act. NIHB benefits apparently mandate that you either stay at the Larga House in Edmonton or the Vital Able home in the community called Delo, which is adjacent to the city of Yellowknife. Your location depends on where your medical appointments or procedures may be located. If either of these facilities are at capacity, as they often are, you are required to stay at the Chateau Louis Hotel in Edmonton or the Great Slave Hotel in Yellowknife. And I must say you are mandated for those locations. You're often told that you are to travel with as minimal notice as 2 to 3 hours prior to a flight, and God forbid that you need to modify your return. You are provided a response from the administration at the NWT Health and Social Services Authority that this can only be done at your cost, which is often anywhere from $100 to $500. You are provided with transportation that at times could have individuals waiting in an airport for up to 90 minutes, and a grand total of $18 per day for meals and incidentals. You then have to submit a travel expense for these costs. I might add $18 a day, and it may take as much as 2 months for a check or an EMT to arrive for you to be reimbursed for those expenditures. I think that is the first thing that needs to be addressed, is that two-tier system that we have in the NWT. I spoke about care and compassion, and we would welcome the opportunity at the Gwich'in Tribal Council to administer a medical travel program on behalf of NIHB, because we feel nobody knows our people better than our own people and the personal situations that many of them find themselves in. That is more understanding, that provides a latitude for our managers to be able to make some of these decisions, because often what we find are government, the NWT staff that are enforcing and taking a very narrow view of the policy, which results in denials, which then gets escalated, appeals are denied, and then gets escalated to elected officials such as the Minister of Health or people like myself or other MLAs of the Northwest Territories. And then some of those decisions are finally rescinded and changed and overturned to allow for medical travel escorts, as I mentioned earlier. So having that level of care, whichever way brings that level of care that I speak about that is so desperately needed into the system, however we do that, we certainly would see a dramatic improvement in the delivery of these services.
Thank you. I have a short minute left. I want to ask one other quick question, and Ms. Wallace, my question is going to be for you. We were having a conversation actually with somebody this morning, and I'm going to try to get this out quick. The challenge of retention of nurses in northern and remote communities, which I'm sure you all experience. I just want to give you an opportunity to speak to that really quickly, as I think we see people moving towards more urban centers and the challenge that creates in some of the northern remote communities like you and I come from. So I'm going to give you some time just to quickly speak to that and the challenge and maybe some ideas of solutions.
Thank you for your question, and it's a great question to close our nursing week. Also, I have experience in working in northern remote communities. The last one I was in northern Ontario during the wildfires last summer, and one of the reasons, well, the many reasons why I had to leave is the working conditions. We ended up being 2 nurses working 24/7, being on calls and just rotating between the 2 of us for a week, and our rotations were for a month at a time. And while we were down south, we needed to self-isolate for 2 weeks at a time before going back because of the pandemic. And my community, they were facing a shortage too. We only have 1 nurse for our whole community, so she was on medical leave, and they approached me and they asked me to cover, being the only RN from my community. So I gladly accepted, but that's just one of the examples why we have such a shortage of nurses. We're kind of sent everywhere, and having the training in primary care were kind of a rare commodity as well. And my training with Indigenous Services Canada was a great asset for my community too. But just the working conditions are just they're terrible. They were terrible before the pandemic, but things just have gone worse. I see lots of nurses going through the onboarding program through Indigenous Services Canada. They would last like 2 months to 6 months, and then they would leave. And I heard 1 year in Northern Ontario that half of their onboarding staff left within the first year of their employment. So that's a lot of costs, and I feel like if we just would invest more funding in the working conditions and the work satisfaction for our nurses, we would avoid having some break of services. We see some communities being without nurses sometimes, and that is tragic for me, and I don't see how that is still happening in 2022.
Thank you very much. We'll now go to